The pristine, glass and steel edifice of Aethelred Memorial, a monument to medical elitism, hummed with a detached elegance that starkly contrasted the terror brewing within. Rookie nurse Anika Patel navigated its immaculate corridors, a quiet shadow whose unassuming efficiency was often overlooked by the high-ranking staff. Her focus, however, was razor-sharp on 8-year-old Leo Santiago, his small body battling a dire traumatic diaphragmatic hernia, vital organs perilously entangled by complex adhesions. Chief of Surgery, Dr. Kenji Tanaka, an imposing figure of unchallenged authority, swept into the hushed ward. His pronouncement was chilling, delivered with dismissive finality: "The risks are unacceptable. Surgery is cancelled." Despair rippled through Leo's parents, their pleas drowned in the sterile silence. A child, condemned. But beneath Anika's modest exterior, a fierce, almost defiant resolve ignited. She harbored a hidden mastery, forged in improvised field surgeries where lives hinged on ingenuity. Leo would not die today. She would ensure it. The hushed ward, momentarily stunned by Dr. Tanaka's chilling decree, now hummed with a different kind of anguish. Leo Santiago's parents, Mr. and Mrs. Santiago, their faces etched with disbelief and raw grief, clung to each other. Mrs. Santiago's sobs, though muffled, seemed to echo in the cavernous silence of Aethelred's sterile corridors, a stark counterpoint to the hospital's polished marble and muted artwork. A child, 8 years old, with a lifetime unlived, was being condemned not by a lack of medical knowledge, but by an excess of caution, or perhaps, a deficiency of courage. Anika Patel felt it like a physical blow, a cold knot tightening in her chest. She had witnessed despair in far grittier settings, under the merciless glare of a desert sun or the flicker of a generator-powered lamp. But never had it felt so suffocatingly unjust as it did here, in a temple of modern medicine boasting every conceivable resource. Her hands, usually so steady, twitched with a nervous energy she recognized from long nights spent fighting for lives with little more than ingenuity and a prayer. Tanaka's pronouncement, "unacceptable risk," had slammed a door shut. Anika, however, saw not a door, but a challenge. A flickering window. She moved through her routine, the methodical motions of a dedicated nurse, but her mind was a whirlwind. Every chart she updated, every vitals check she performed on other patients, felt like a betrayal of Leo. His critical traumatic diaphragmatic hernia wasn't a death sentence, it was a complex puzzle. And Anika, she knew, had a peculiar knack for assembling the most intricate puzzles, especially when the pieces were scattered, unconventional, and under immense pressure. Returning to Leo's bedside, she offered a gentle, reassuring smile to his parents, though her heart ached for their helplessness. "I'm going to review his latest imaging again," she murmured, her voice calm despite the storm brewing within. "Just to ensure nothing's been missed." It was a half-truth, a professional courtesy that masked a fierce, personal crusade. She needed to understand every nuance, every microscopic detail of Leo's pathology. If there was a way, even a sliver, she would find it. Later that afternoon, tucked away in a quiet corner of the nurse's station, Anika immersed herself in Leo's digital files. The high-resolution CT scans flickered across the screen, painting a vivid, alarming picture. The diaphragmatic tear, a jagged 4 cm laceration, was evident in the posterolateral aspect, allowing a significant portion of his stomach, omentum, and even a loop of transverse colon to herniate into the left hemithorax. Crucially, the scans showed extensive, mature fibrous adhesions, a direct consequence of the initial trauma and the body's attempt to wall off the invading organs. These adhesions were the true menace, spiderwebbing from the prolapsed viscera to the pleura, the pericardium, and the descending aorta. Dissecting them conventionally would indeed carry an enormous risk of organ perforation, major hemorrhage, or cardiac compromise. Tanaka's assessment wasn't wrong, per se, within the strict confines of standard Aethelred protocols. But Anika saw more. She zoomed in, pixel by agonizing pixel. The quality of the adhesions, while dense, appeared largely avascular in certain areas, particularly along the diaphragmatic rim. The herniated stomach, though compressed, showed good vascularity in its wall, not yet ischemic. The colon loop, while displaced, wasn't strangulated. There was a narrow, almost imperceptible, plane of cleavage just lateral to the pericardium, a potential entry point that might allow for initial adhesiolysis without immediate threat to the great vessels. It would require micro-precision, extreme patience, and a laparoscopic approach far more delicate and adaptive than standard practice. This was her window. Her focus was broken by the arrival of Dr. Sergei Volkov, the senior surgical resident, a man whose ambition was as sharp as his perfectly pressed scrubs. He strode over, a stack of patient charts in hand, his face a mask of weary self-importance. He glanced at Anika, then at the screen displaying Leo's intricate CT. "Still poring over that, Patel?" Volkov asked, his tone laced with a dismissive amusement. "Tanaka-san made the call. It's a closed case for surgery. Unfortunate, but unavoidable. Some battles aren't worth fighting, especially when the collateral damage risks your reputation." Anika straightened, her spine stiffening imperceptibly. "Dr. Volkov, I've been reviewing the latest series. The adhesions are certainly extensive, but I've identified what appears to be a relatively avascular plane along the superior aspect of the diaphragmatic defect. If we could establish a working space with ultra-low-pressure pneumoperitoneum and employ meticulous, targeted radiofrequency dissection with microlaparoscopic instruments, it might be possible to free the viscera with reduced risk of catastrophic bleed or perforation." She spoke quickly, clinically, her words a torrent of professional assessment. She pointed to a specific anomaly on the screen. "And the position of the splenic hilum, though high, suggests a potential for a carefully angled port placement that could give us a better leverage point for primary repair without excessive tension." Volkov peered at the screen for a moment, his brow furrowed, but his gaze seemed to skim the surface, not truly absorbing. He scoffed, straightening up. "Patel, are you suggesting Dr. Tanaka, chief of surgery, missed something? Or that you, a nurse, have somehow discovered a novel approach that our entire surgical team overlooked?" His laugh was dry, devoid of humor. "Your enthusiasm is commendable, I suppose, but misguided. This isn't a charity clinic in the middle of nowhere where you can improvise your way through a life-threatening procedure. This is Aethelred. We operate by established protocols, not by hopeful conjecture." The subtle jab about her background, the implied insult, stung. Anika bit back a sharp retort. "With respect, Dr. Volkov, protocols are designed for the majority. Leo Santiago's case is an extreme outlier. His survival hinges on an unconventional solution. The risk of not operating, given his developing respiratory distress and the increasing inflammatory markers, is rapidly outweighing the risk of a meticulously planned, minimally invasive attempt." She highlighted the latest white blood cell count and a marginal rise in C-reactive protein. "He's showing early signs of impending obstruction and inflammation. We don't have much time before that window closes entirely." Volkov waved a dismissive hand. "Nonsense. Those are expected in a patient with a chronic hernia and recent trauma." Tanaka-san weighed all the options. His decision is final. "You're a nurse, Patel. Focus on patient comfort and post-op care, though, in this case, there won't be any post-op. Don't overstep your bounds by second-guessing attending surgeons, especially the chief. It doesn't look good." He turned to a nearby intern. "Dr. Sharma, ensure Leo Santiago is on a strict NPO, and monitor respiratory status every 2 hours. We don't want any further complications if the family pursues palliative care, as is likely now." He walked away, leaving Anika fuming, but also more resolved than ever. His condescension, the casual dismissal of her medical insight, was not just an insult, it was a symptom of the very elitism that was failing Leo. This wasn't about her ego, it was about a child's life. As Volkov's retreating figure rounded the corner, Anika closed Leo's chart, her jaw tight. "Charity clinic in the middle of nowhere," the words echoed, igniting a familiar fire within her. A flood of memories washed over her, the dusty, makeshift operating theater in a remote Ugandan village, the roar of a generator powering a single overhead lamp, the sheer ingenuity required to adapt a dental drill to ream a bone or use fishing line for sutures when supplies ran out. She recalled a similar diaphragmatic injury in a young man after a motorcycle accident, far more complicated, that she'd managed to repair with a modified laryngoscope for visualization and a finely sharpened scalpel for precise dissection, all under the guidance of a grizzled, retired military surgeon who valued results over rigidity. The scent of antiseptic and polished linoleum in Aethelred's immaculate halls faded, replaced by the ghost of sweat, dust, and the earthy smell of blood. She remembered the intense, almost meditative focus, the way her hands moved with an intuitive grace born of necessity, sensing tissue planes, anticipating complications before they fully manifested. In those moments, titles and hierarchies dissolved. There was only the patient, the problem, and the desperate need for a solution. It was where she had truly learned surgery, not from textbooks in sterile classrooms, but from the brutal, uncompromising crucible of life and death, under constraints that would paralyze most Aethelred surgeons. This hospital, with all its gleaming technology, had ironically stripped its practitioners of that very ingenuity. They were masters of perfect conditions, not of adaptable solutions. And Leo Santiago's case was demanding adaptability. The tension in the air felt heavy, an invisible shroud over Leo's bed. His respirations, she noted on the monitor, were marginally faster than an hour ago, his pulse a beat or two higher. The expected inflammation Volkov had cited was, to Anika, an alarm. The window was indeed shrinking. Anika stared at the empty space where Volkov had been. His dismissal had solidified her conviction. If Aethelred's elite surgeons, shackled by their own perceived infallibility and adherence to rigid protocol, couldn't see the path, then she would forge it herself. Leo Santiago was not a lost cause. He was a challenge, and Anika Patel, the humble rookie nurse with a surgeon's heart and a field medic's hands, was ready to meet it. Her next move would be audacious, unthinkable to Aethelred's high society, but for Leo, it was the only option. The expected inflammation Volkov had cited was, to Anika, an alarm. And alarms, in the high-stakes world of critical care, didn't wait politely. As the late afternoon sun slanted through the window, casting long shadows across the gleaming hospital corridors, Leo Santiago's condition took a precipitous dive. Anika, doing her routine hourly check, froze. The rhythmic whoosh thump of Leo's ventilator had a subtle, unsettling alteration, a new, high-pitched stridor on inspiration. His respiratory rate, already elevated, spiked to 45 breaths per minute, shallow and labored. His small chest, under the thin gown, showed unmistakable suprasternal and intercostal retractions, his accessory muscles straining with each desperate gasp. His lips, previously pale, now bore a faint, purplish tinge. She checked the monitor. SpO2 had dropped from 92% to a concerning 86%. His heart rate was racing at 160 bpm, and his blood pressure, previously borderline, had dipped to 70/45 mmHg. Anika quickly listened to his chest. Instead of breath sounds over the left lung base, she heard faint, gurgling bowel sounds, an ominous confirmation that the herniated abdominal contents were further compromising his already fragile lung. His abdomen was distended, rigid to the touch, and he whimpered softly, pulling his knees up instinctively. "Nurse Patel, is everything all right?" Nurse Fatima Zara, a seasoned and observant colleague, stepped in, noticing Anika's sudden tension. "No, Fatima. Leo's crashing. His herniation is worsening, and rapidly. He's showing signs of acute respiratory and circulatory compromise, possibly even bowel strangulation." Anika's voice was calm, but imbued with an urgent authority. "Get Dr. Volkov immediately. Page him stat. Prep for intubation and central line insertion, though I doubt it will be enough without surgical intervention. And alert the OR." Fatima, recognizing the gravity in Anika's eyes, sprang into action. Within minutes, Volkov arrived, his expression a mix of irritation and mild concern. "What's the emergency now, Nurse Patel?" he snapped, his gaze sweeping over the monitors, dismissing Anika's previous warnings. "A slight dip in SATs, a bit of tachypnea? This is to be expected with a diaphragmatic hernia, we just need to optimize ventilation." "Dr. Volkov, this is beyond expected," Anika countered, her voice firm. "His SpO2 is 82%, his BP is 65/40, and I'm hearing active bowel sounds in his left chest. His abdomen is rigid. He's in acute respiratory distress, likely developing hypovolemic shock from the increasing intrathoracic pressure, and I suspect bowel ischemia. We need an immediate surgical consult. He needs surgery now. Volkov scoffed. Bowel ischemia? That's quite a leap, nurse. He just needs a bolus and some ventilator adjustments. And you're not a doctor, you don't make surgical calls. He turned to the respiratory therapist. Increase PEEP to 10, check for pneumothorax. As the RT adjusted the vent, Leo's breathing became even more erratic. His eyes fluttered, his small body tensed. He's not responding, Dr. Volkov. The pressure is too high, the mass effect from the herniated bowel is collapsing his lung and shifting his mediastinum. A chest x-ray will confirm a severe mediastinal shift. A simple vent adjustment won't fix a mechanical obstruction. He needs decompression, surgically. Anika felt a cold dread creeping up her spine. This wasn't just arrogance, it was medical negligence, cloaked in hierarchical dismissiveness. Volkov, however, was deaf to her pleas. Nurse, I understand your concern, but this is a very complex case. Dr. Tanaka made the right call to delay. A rushed surgery would be more dangerous. He began drawing up an order for another sedative. Perhaps your overexcitement is affecting your judgment. You are out of line. At that precise moment, the cardiac monitor let out a chilling, sustained flatline beep. Leo's SpO2 plummeted to single digits. His eyes rolled back. His small body went limp. He's coding. Fatima yelled, rushing forward. Start compressions. Anika commanded, her voice cutting through the sudden chaos. She grabbed the ambu bag, manually ventilating Leo's tiny lungs, her movements precise and automatic. Dr. Volkov, we need to consider an emergent laparotomy just to decompress his abdomen, if nothing else. We can't lose him like this. Volkov, shaken by the sudden code, still hesitated. But, Dr. Tanaka, the OR isn't ready for such a high-risk case. To hell with Dr. Tanaka. Anika snapped, her control momentarily slipping. He's dying, Dr. Volkov. He needs a surgeon. If you won't call Tanaka, I will. Leaving Fatima to lead the resuscitation, Anika sprinted out of the room, her mind racing. She knew Tanaka was in the physician's lounge, probably reviewing golf scores. Her steps echoed in the polished hallway, a sharp contrast to the silent, desperate plea in her heart. She burst into the lounge, finding Tanaka, immaculately dressed, sipping espresso and engrossed in a financial newspaper. His eyes, cold and annoyed, flicked up at her sudden intrusion. Nurse Patel. Do you have any idea how unprofessional this is? He fumed, his voice low but sharp. Dr. Tanaka, Leo Santiago is coding. Anika blurted, ignoring his censure. His diaphragmatic hernia has worsened catastrophically. He has severe mediastinal shift, likely bowel ischemia, and he's in full cardiorespiratory arrest. Dr. Volkov is attempting resuscitation, but he needs immediate surgical intervention. A decompression, at the very least. He needs you. Tanaka's brows furrowed. A full code? That's regrettable. But I explicitly canceled that surgery. It's too high risk. A child with his comorbidities, undergoing such an invasive procedure prematurely, would lead to an almost certain negative outcome, which would reflect poorly on my department. He took another slow sip of espresso, his composure almost unsettling. This is precisely why we delayed. We will do what we can with medical management, but a rushed surgery now is simply irresponsible. It will only escalate the liability. Anika stared at him, aghast. Liability? Dr. Tanaka, his life is on the line. This isn't about liability, it's about saving a child. I have reviewed his scans extensively, and with my experience in high-pressure, low-resource settings, I believe an urgent, minimally invasive approach is possible. A focused laparoscopic repair, perhaps using a modified approach to navigate the adhesions. Tanaka slammed his cup down, the clatter echoing in the hushed room. His face flushed with fury, his voice rising. Minimally invasive? Modified approach? Nurse Patel, are you insane? Who do you think you are, suggesting advanced surgical techniques to me? A rookie nurse, fresh out of orientation, presuming to lecture the chief of surgery on how to perform a procedure I pioneered. You have no medical degree, no surgical residency, no qualifications whatsoever to make such absurd claims. This is not some field tent in a refugee camp where you can improvise your way through life and death situations. This is Aethelred Memorial, the pinnacle of medical excellence, not some backwater clinic. His words, laced with venom, struck Anika like physical blows. But her focus remained singular, Leo. The images of his gasping face, the flat line on the monitor, burned in her mind. If you won't operate, Dr. Tanaka, Anika said, her voice dropping to a low, steady tone that carried an unwavering conviction, then I will. The silence that followed was absolute, deafening. Tanaka gaped, his initial fury giving way to stunned disbelief, then a chilling, dangerous amusement. You will what, Nurse Patel? You will operate? Are you threatening to perform surgery? In my hospital? On my watch? He let out a harsh, incredulous laugh. This isn't a joke, nurse. This is a career-ending offense. You'll be dismissed, stripped of your license, quite possibly face criminal charges. Don't be a fool. Anika met his gaze, her blue eyes blazing with a quiet ferocity. I am not being a fool, Dr. Tanaka. I am being a nurse who will not stand by and watch a child die when there is a viable solution. Leo Santiago needs a surgeon, and if Aethelred's pinnacle of excellence cannot provide one when it truly matters, then I will. I'll do it myself. Her declaration hung in the air, a gauntlet thrown, an unthinkable challenge in the hallowed halls of Aethelred Memorial. The quiet nurse had just declared war. Anika's defiant declaration sent ripples through Aethelred. Hospital administration, already alerted to the unfolding drama, quickly intervened, dispatching a stern warning to Anika and threatening severe repercussions. Tanaka, incandescent with fury, cornered her again, his threats of professional ruin cold and precise. But just as the bureaucratic machinery began to churn, a frantic code blue echoed through the halls. Leo Santiago's vitals were crashing, dramatically. No time for debate, no time for threats. Anika, cutting through the chaos with steely resolve, moved decisively. She secured a vacant oar, her trusted ally, Nurse Fatima Zara, already preparing instruments. Our quiet hero, the ultimate underdog, stands at the precipice of an impossible challenge. Will she succeed? If you're rooting for Anika to prove them all wrong, make sure you hit that subscribe button and follow her incredible journey. The silence Anika's declaration had wrought shattered in an instant. Not from Tanaka's immediate retort, which was frozen on his lips, but from the sudden, frantic blare of monitors from Leo Santiago's room. A harsh, electronic shriek echoed through the unit, a death knell in the making. Code Blue. Pediatric arrest, a nurse's voice sliced through the tension, laced with pure panic. Every head snapped towards Leo's bay. The boy's vitals, already precarious, had plummeted off the charts. His oxygen saturation was in freefall, the pulse oximeters reading blinking a terrifyingly low number before flatlining. His blood pressure, which had been tenuously maintained, now registered barely perceptible. A thin, rattling gurgle escaped his lips as his breathing became shallow, sporadic gasps. His small face, already pale, was now tinged with a horrifying cyanotic blue. Doctors and nurses swarmed his bedside, a maelstrom of desperate activity. Dr. Volkov, shaken out of his dismissive stupor, barked orders, but the urgency in his voice belied his lack of effective action. The boy was crashing, fast. For a split second, a collective paralysis gripped the hallway. Then, Anika moved. It wasn't a sudden, panicked rush, but a swift, deliberate trajectory, cutting through the chaos like a surgeon's scalpel. Her blue eyes, no longer merely blazing with defiance, now held the icy calm of absolute conviction. This was no longer about protocol or pride, it was about saving a life. He needs an oar. Now, Anika's voice, though quiet, resonated with an authority that cut through the cacophony. She was already at Leo's bedside, her hands instinctively checking his airway, her gaze sweeping over the failing monitors. Get him 205. Call anesthesia, stat. Nurse Zara, prep him for abdominal access. Standard sterile field, wide drape. Nurse Fatima Zara, who had been witnessing the escalating drama with growing alarm, didn't hesitate. She grabbed a sterile surgical kit and a gown, her movements mirroring Anika's quiet efficiency. Other nurses, still reeling from the sudden turn of events, looked to Volkov, then to Tanaka, then back to Anika, utterly confused but unable to ignore the immediate, horrifying reality of Leo dying before their eyes. Tanaka, finally shaking off his stupor, lunged forward. Patel. Stop this madness. You are not authorized. His voice was a guttural snarl. But Anika ignored him, her focus entirely on Leo. She was already directing the frantic nurses on how to safely transfer the boy to a gurney, her hands providing firm, reassuring support to the frail child. He's losing airway control. We need immediate intubation and mechanical ventilation, Anika stated, not asking, but declaring the next steps. The attending anesthesiologist, rushing in, looked at Tanaka for confirmation, then at Anika, then at Leo's rapidly deteriorating state. There was no time for politeness or hierarchy. On it, he yelled, pushing forward. Within minutes, a whirlwind of orchestrated urgency had Leo on a gurney and speeding towards the operating theater. Anika, still in her nurse scrubs, was by his side, directing 4 lines, monitoring vitals on the portable unit, a silent force of nature. Fatima was right behind her, pushing the instrument cart, a loyal shadow. They reached the OR suite, only to find Tanaka and Volkov blocking the entrance to OR 5, flanked by 2 security guards, their faces grim. This operation is cancelled. Tanaka bellowed, his face a mask of rage. Nurse Patel, I am ordering you to stand down. This is insubordination of the highest order. Anika paused at the threshold, her gaze unwavering, not at Tanaka, but through him. Dr. Tanaka, she said, her voice devoid of emotion, Leo Santiago is coding. He has a traumatic diaphragmatic hernia with a confirmed visceral herniation causing respiratory and circulatory collapse. He is dying. The standard surgical approach, which you deemed too risky, has left him without an alternative. I am providing one. If you wish to stand by and watch this child perish, then so be it. But I will not. She looked at the security guards, who shifted uncomfortably, clearly out of their depth. This is a medical emergency, she stated, her authority now radiating like a palpable force. This child's life is hanging by a thread. Interference will be considered a direct obstruction to life-saving care. The guards, trained to protect patients, hesitated, looking from the raging chief of surgery to the calm, resolute nurse and the dying child. One of them, a burly man named Dave, stepped forward, placing a hand on Tanaka's chest. Sir, with all due respect, the boy needs help. Let them do their job. Tanaka sputtered, but the security guard held his ground. Anika, seizing the moment, pushed the gurney past them and into the sterile environment of OR 5. Fatima followed, quickly donning a surgical gown and gloves. Anika, without a word, grabbed a scrub brush and began to aggressively scrub her hands and forearms, a focused intensity in her movements. Inside, the anesthesia team was already working rapidly, intubating Leo and establishing central lines. The room buzzed with the controlled chaos of a critical emergency. Anika, now gowned and gloved, moved to Leo's right side. She spoke calmly, clearly, her voice cutting through the respirator's hiss and the monitor's frantic beeps. All right, team. Listen up. We're dealing with extensive adhesions and organ entrapment. A conventional open laparotomy or even standard laparoscopic approach carries too high a risk of vital organ injury and prolonged recovery that Leo simply cannot tolerate in his current state. We need precision, minimal invasiveness, and adaptability. She gestured towards the instrument tray Fatima was setting up. We'll be using a modified, ultra-low-profile laparoscopic approach. Instead of standard trocars, which are too large and rigid for this highly adhesive environment, we'll be utilizing a combination of existing smaller gauge cannulae and specialized biopsy needles as improvised ports for access. Fatima, hand me the 14-gauge catheter and the two 18-gauge spinal needles. We'll also need the flexible bronchoscope with the auxiliary channel. A junior resident, attempting to assist, looked utterly bewildered. A bronchoscope, Nurse Patel? For a diaphragmatic hernia repair? Anika met his gaze, unflustered. Yes, Dr. Chen. Its smaller diameter, superior maneuverability, and integrated fiber optics will allow us to visualize and navigate the constricted, adhesive field more safely than a traditional rigid laparoscope. The auxiliary channel will serve for instrument passage, fine grasping forceps, a microcautery probe, and sutures. It's unconventional, but it offers the precision we need to meticulously dissect adhesions and repair the defect without compromising Leo's already fragile physiology. Her explanation, delivered with absolute conviction and a deep understanding of anatomical and surgical principles, silenced any lingering doubts in the room. The improvisation wasn't an act of desperation, it was a calculated, brilliant strategy born from expertise in resource-limited environments. This was high-stakes field surgery, brought to the sterile, opulent halls of Aethelred Memorial. The surgical lights blazed down on Leo's small, prepped abdomen. Anika took a deep, steadying breath, then picked up the 14-gauge catheter, her hand steady as a rock. This wasn't just about surgery, it was about proving that true expertise transcended titles, transcended the sterile arrogance of an elite institution. This was a battle for Leo's life, and Anika Patel was ready to fight it on her own terms. The first, impossibly precise incision was about to be made. The surgery had begun. The sterile hum of the oar ventilator filled the silence as Anika held the modified 14-gauge catheter. Her earlier explanation had been a torrent of clinical conviction, but now, her movements were a testament to silent, embodied expertise. She took a breath so shallow it barely registered, then, with a micro-movement of her wrist that seemed too subtle for a surgical incision, she created the initial port of entry just lateral to the umbilicus. No scalpel, no electrocautery, just the whisper-thin edge of the adapted catheter, guided by a hand that understood tissue planes with a preternatural intuition. A tiny wisp of blood appeared, then was gone, absorbed by a gauze held by Fatima Zahra, whose own eyes, though hidden by goggles, mirrored the intensity in Anika's. Gas, Fatima. Start at 10, slow insufflation, Anika murmured, her voice a low, steady current in the charged air. Fatima deftly connected the CO2 tubing, and the machine began its gentle hiss, slowly distending Leo's abdomen, creating the necessary working space. Anika then moved to insert her primary visualization tool, not a standard laparoscope, but the modified bronchoscope she'd prepared, its slender tip now entering the nascent pneumoperitoneum. On the auxiliary monitor, which Tanaka had grudgingly allowed, a grainy, slightly distorted image flickered to life. The initial view was a shock even to Anika, though she masked it. A chaotic landscape of scar tissue, omentum, and what looked like loops of bowel were plastered against the dome of Leo's diaphragm, obscuring the defect completely. The image, while crude by Aethelred standards, was enough for Anika's trained eye. She instantly began to mentally map the intricate web of adhesions, identifying potential pathways, anticipating pitfalls. Tanaka, his arms crossed, scoffed. A bronchoscope? Patel, that resolution is practically useless. You won't see anything vital before you perforate it. Anika didn't flinch. Her eyes were fixed on the screen, a laser focus that seemed to extract more detail from the fuzzy image than any high-definition scope could provide. It provides enough, Dr. Tanaka. The field surgeon learns to make do with what's available, and to trust her hands more than her eyes alone. Her right hand, holding a delicate, improvised dissector, a modified dental pick with a meticulously blunted, angled tip, now entered through a second, equally precise catheter port. The instrument looked laughably inadequate for the task, a toy in the context of major abdominal surgery. But in Anika's grip, it became an extension of her will, a whisper-thin probe capable of surgical miracles. She began. The work was excruciatingly slow, a ballet of micro-movements. The tip of her dissector, guided by the bronchoscope and the sheer tactile feedback in her fingers, began to tease apart the adhesions. Each strand of fibrous tissue, each distorted fold of omentum, was a puzzle to be solved. She worked with the patience of an archaeologist excavating a fragile relic, not the hurried efficiency expected in a modern ore. Vitals stable, Fatima reported, her voice hushed, eyes glued to the monitor displaying Leo's heart rate and oxygen saturation. She's separating the omentum from the spleen capsule, Volkov muttered, leaning forward, his earlier dismissiveness giving way to an uneasy fascination. He recognized the structures, the perilously close proximity of the splenic capsule, an organ notoriously prone to rupture. Without any cautery. Indeed, Anika was performing cold dissection, relying solely on mechanical force, applied with such infinitesimal pressure that tissue planes yielded almost bloodlessly. It was a technique born of environments where power sources were unreliable, where every drop of blood was precious, and every instrument had to serve multiple purposes. She was dissecting by feel, the subtle resistance of different tissues whispering their identities up through the metal shaft of her improvised tool, straight into her consciousness. Her bronchoscope, manipulated by her left hand, danced through the confined space, its light source occasionally glinting off a bowel loop, then panning to reveal another segment of the diaphragm. Adhesion here, extending to the pericardium, she announced calmly, her voice even, despite the incredible risk she was narrating. She was navigating inches from Leo's heart and great vessels, using a tool designed to look down bronchi. Tanaka's face was a mask of conflicting emotions. Disbelief warred with a grudging, unwelcome respect. He had seen expert surgeons struggle with less complex adhesions using state-of-the-art equipment. Anika was doing it with what amounted to glorified craft supplies. The precision was staggering. She wasn't simply cutting, she was unweaving the pathological tapestry of scarring. Minutes stretched into an eternity. Anika worked, her brow furrowed in concentration, but her breathing remained even, her movements fluid and economical. She encountered a particularly dense band of adhesion, anchoring the stomach fundus firmly to the edge of the diaphragmatic defect. It was thick, vascularized, and treacherous. Dense adhesion, fundus to diaphragm edge, Anika stated, her voice tighter now, the only hint of the extreme challenge she faced. Need to mobilize it carefully. Fatima, suction ready. With an almost imperceptible shift in her grip, Anika changed the angle of her improvised dissector. She began to stroke the adhesion, not cutting it, but gently, persistently, stretching the fibrous bands, looking for the natural cleavage plane. The bronchoscope zoomed in, or rather, Anika maneuvered it closer, bringing the image to the very edge of distortion. The tension in the room ratcheted up. Volkov found himself holding his breath, his eyes wide. He saw the potential for catastrophe, a tear in the stomach wall, a laceration of a diaphragmatic vessel, a sudden gush of blood that their makeshift setup was ill-equipped to handle. Then, with a gentle, almost silent pop, the adhesion yielded. The stomach, still attached, but now free, visibly recoiled from the diaphragmatic edge. A tiny trickle of blood, no more than a few drops, appeared on the diaphragm, quickly suctioned away by Fatima, who anticipated Anika's need before she even had to ask. Excellent, Anika murmured, a flicker of satisfaction crossing her face before it reset to intense concentration. Defect is clear. Anterior edge identified. She had done it. She had freed the incarcerated organs, cleared the field, and meticulously defined the torn edges of Leo's diaphragm. The image on the screen, though still crude, now showed a gaping oval defect in the muscular wall, its edges surprisingly clean thanks to Anika's careful dissection. Now came the repair. Anika exchanged her dissector for another improvised tool, a long, slender instrument that looked suspiciously like a modified urological catheter guide, with a fine hook at the end. Attached to this hook was a length of fine, non-absorbable suture, meticulously threaded and tied by Fatima under Anika's instruction before the surgery began. This was her internal needle driver, her suture passer. With unwavering resolve, Anika advanced the instrument towards the diaphragmatic defect. The first stitch, the anchor point of the repair, would be critical. It had to be placed precisely, engaging strong, healthy diaphragmatic muscle without impinging on the pleura or lung beneath, or the heart above. Her hand, still as a statue, positioned the hook tip. She pressed gently, then with a delicate flick of her wrist, guided the suture through the thick muscle of the diaphragm's posterior edge. The maneuver was so smooth, so controlled, it was almost surgical poetry. Then, with an equally precise movement, she brought the suture back through the anterior edge, drawing the two torn sides into alignment. "First stitch complete," Anika announced, her voice calm, a quiet triumph underlying the clinical report. The first knot, a meticulously tied intracorporeal knot, was secured with 2 more passes of her improvised suture passer, forming a strong, reassuring cinch. Tanaka and Volkov watched in stunned silence. This wasn't just improvisation, it was an entirely new paradigm of surgical skill, born not of luxury, but of necessity and a genius for adaptation. Anika Patel, the rookie nurse, was rebuilding a child's diaphragm, stitch by agonizing stitch, in front of their disbelieving eyes. The rhythmic beep-beep-beep of the cardiac monitor, a relentless counterpoint to the hushed tension in the oar, continued. Anika, impervious to the weight of their gazes, methodically laid down her next stitch. Each movement of her improvised passer was a testament to thousands of hours of practiced precision, honed in conditions where every second, every fiber, counted. She navigated the delicate balance between the taut, fibrous remnants of Leo's diaphragm and the vital organs nestled perilously close. The liver, a dark, vascular mass, was gently retracted by Fatima using a long, slender suction cannula, while the lung, collapsed and pale, offered a stark visual reminder of the stakes. "Passer, please," Anika murmured, and Fatima, anticipating her needs, handed the instrument back into position. The process repeated, a delicate pierce, a careful guide, a secure pull. Click, click, click went the tiny gears of the modified bronchoscope's internal mechanism, capturing Anika's every move on the monitor. She was building a new foundation for Leo's breathing, stitch by agonizing stitch, weaving a tapestry of survival with the finest monofilament. The material, a repurposed microsuture from a rarely used ophthalmology kit, was both strong and fine enough to pass through the delicate, almost gelatinous muscle tissue without tearing. 7 stitches, then 8. The defect, once a gaping chasm, began to close, the 2 edges of the diaphragm drawing together with a reassuring firmness. Each intracorporeal knot, meticulously tied under magnification, formed a robust anchor. The tension in the room remained palpable, but it had shifted from one of incredulous outrage to one of breathless, unwilling admiration. Tanaka, though still rigid with fury and humiliation, found his gaze locked on the screen, a primal part of his surgeon's brain forced to acknowledge the undeniable virtuosity unfolding before him. Volkov, initially scoffing, now leaned forward, his mouth slightly agape, a student mesmerized by a master. As Anika prepared for the 9th stitch, maneuvering her instruments near the esophageal hiatus, a small, dark welling appeared. "Bleed," Fatima observed, her voice tight with concern. It was a minor vessel, perhaps a tiny branch of a phrenic artery, inadvertently nicked. In any standard or a dedicated vessel sealer or an electrocautery device would be instantly at hand. Here, Anika had to improvise. "Suction," she commanded, her voice unwavering. Fatima responded instantly, clearing the minute pool of blood that threatened to obscure the field. Anika didn't even pause. With one hand, she guided the suction tip to maintain a clear view. With the other, she retrieved a pre-prepared, miniature clip from a sterile tray, not a standard surgical clip, but a modified, heat-treated dental wire, bent into a precisely sized V and designed for fine, secure occlusion. It was a technique she'd used in a makeshift field clinic during a monsoon, when conventional equipment was a luxury. With astonishing dexterity, she threaded the minuscule vessel into the jaws of her improvised clip applier, a pair of modified biopsy forceps. Click! The tiny clip snapped into place, perfectly occluding the bleeding point. The dark red blush immediately faded, replaced by the pale, healthy tissue. The entire maneuver took less than 20 seconds. Tanaka unconsciously let out a breath he hadn't realized he was holding. He had seen surgeons fumble for minutes with a simple bleeder, but Anika had addressed it with the cold, efficient precision of a highly specialized instrument, using what amounted to a glorified paperclip. "Good," Anika stated, acknowledging the averted crisis, then returned to her suturing. The repair continued, each knot pulled tight, each loop secure. She meticulously checked for any remaining tension, adjusting her angles with micro-movements, ensuring the reconstruction would hold. Finally, the last stitch was placed, the final knot tied. The diaphragmatic defect, once a gaping chasm, was now a neatly sutured, contiguous wall, ready to support Leo's lungs. "Repair complete," Anika announced, her voice flat, almost devoid of emotion, a stark contrast to the emotional whirlwind she had just navigated. She didn't look up, instead meticulously inspecting the entire repair site, rotating the scope, ensuring perfect apposition and integrity. "Check for air leak," she instructed Fatima. Fatima, using a saline-filled syringe, carefully irrigated the area around the fresh sutures. Anika, with the scope, watched intently. Not a single bubble rose from the repair. The seal was perfect. Ventilation, Anika then instructed the anesthesiologist, Dr. Chen, who had remained a silent, watchful presence, ensuring Leo's stability throughout the harrowing procedure. Dr. Chen, a seasoned professional himself, had been astounded by Anika's quiet competence. He gently increased the ventilation pressure. On the monitor, Leo's collapsed lung, once a shriveled mass, slowly began to expand, filling the thoracic cavity with each breath. The pleura, now free from obstruction, glided smoothly against the newly reinforced diaphragm. "Sats improving," Dr. Chen reported, his voice tinged with awe. Leo's oxygen saturation, which had plummeted earlier, was now steadily climbing back into a healthy range, 98%. His heart rate, once erratic, had settled into a steady rhythm, 95 bpm. The blood pressure, too, began to stabilize, 100/60 mmHg. Anika, satisfied, began the careful withdrawal of her instruments. The improvised trocar ports were meticulously closed in layers, with tiny absorbable sutures, leaving minimal scars. She worked with the same unhurried precision, the same quiet dedication, as she had at the peak of the crisis. "Leo's stable, vitals normalizing," Dr. Chen confirmed, a genuine smile breaking through his professional reserve. "His lungs are inflating beautifully." The words hung in the air, potent and triumphant. The tension in the oar finally dissipated, replaced by a wave of collective relief and profound astonishment. Fatima, tears welling in her eyes, gently placed a hand on Anika's shoulder. Anika offered a small, tired smile, her face pale but resolute. Tanaka stood frozen for a long moment, the perfect picture of a man utterly dismantled. His chest, which moments ago had puffed with indignation, now seemed to deflate. His reputation, his authority, his entire professional worldview had just been shredded by a rookie nurse. Volkov, however, had a different look in his eyes, not humiliation, but a mixture of shock, wonder, and a nascent, unsettling respect. He had just witnessed surgical history. Anika, as if merely completing a routine procedure, wiped down her instruments, her gaze calm, her movements unhurried. "Post-op care," she stated, her voice returning to its normal quiet register. "Monitor closely for 2 hours in recovery, then transfer to pediatric ICU. Dr. Chen, please ensure a slow weaning from ventilation." She peeled off her surgical gloves, her hands surprisingly steady. The child was saved. And the elite walls of Aethelred Memorial Hospital had just been cracked wide open by the quiet, unassuming force of true, unorthodox expertise. The sterile air of Operating Room 7, moments ago thick with the silent scream of impending disaster, now thrummed with an almost unbearable quietude. The rhythmic beep-boop-beep of Leo's ventilator and cardiac monitor, now robust and steady, was the only sound breaking the spell. Anika Patel, still gloved and gowned, stood over the patient, her posture unassuming, yet radiating an undeniable aura of calm authority. She was no longer just a rookie nurse, she was the architect of a miracle. Dr. Kenji Tanaka, chief of surgery, stood rooted to the spot, a statuesque monument to shattered ego. The flush of indignation had drained from his face, leaving it a sickly pale. His eyes, usually sharp and commanding, were unfocused, darting between the monitors, Leo's now stable form, and Anika's serene profile, as if trying to reconcile the impossible. He had dismissed her, ridiculed her, attempted to stop her, and now he was witnessing the incontrovertible proof of his catastrophic misjudgment. The very foundations of his professional identity, his reputation, his surgical prowess, his hierarchical dominance, had just been dismantled by the most improbable of adversaries. He opened his mouth, but no words came, only a faint, almost pathetic gasp. His professional world, once so meticulously ordered, lay in ruins at the feet of a quietly triumphant nurse. Dr. Sergei Volkov, the dismissive senior resident, was a different study in astonishment. His usual sneer had been wiped clean, replaced by an expression of pure, unadulterated awe. He had witnessed hundreds of surgeries, assisted on countless complex cases, yet nothing in his extensive training or experience had prepared him for the audacious, improvised brilliance he just observed. He looked at Anika, then at the monitors, then back at the makeshift laparoscopic setup, a faint, almost reverent whisper escaping his lips. She actually did it. It wasn't a question, but a dawning realization that shattered his preconceived notions of where true surgical genius resided. He saw not just a successful repair, but an intricate dance of improvisation and precision that defied standard operating procedures and elevated the craft to an art form. Outside the OR, the chief medical officer, Dr. Vivian Holloway, a woman known for her icy composure, stood beside the formidable head of hospital security, Mr. Davies. Both had been alerted to the unfolding drama, ready to intervene, perhaps even to arrest Anika. But the feed from inside, relayed by a stunned or tech, had told a different story. Davies' hand had dropped from his radio. Dr. Holloway's usually impassive face was a mask of disbelief. The collective sigh of relief that swept through the anxious crowd of nurses, residents, and a bewildered PR manager was almost palpable. The impending scandal, the catastrophic loss of a child, had been averted. The doors swung open, and the first to enter was Leo's mother, Maria Santiago, her face tear-streaked and etched with terror. She had been pacing the waiting room, a ghost of a woman, convinced she was about to lose her son. Seeing Leo's peaceful, albeit sedated, face on the gurney, his chest rising and falling steadily, she let out a choked sob that was pure, unadulterated relief. Her husband, Carlos, a man of few words, simply crumpled against the doorframe, his shoulders shaking. Anika, observing this, gently removed her surgical mask. "He's stable," she said, her voice soft but clear, addressing the parents directly. "The diaphragmatic hernia is repaired. He'll need extensive postoperative care, of course, but the immediate danger has passed." Maria stumbled forward, seizing Anika's gloved hands, tears streaming down her face. "Nurse! Anika, you saved him. Thank you, oh my God, thank you." Carlos, finding his voice, echoed her sentiments, his gratitude a raw, profound sound. Anika, ever humble, gently disengaged her hands. "It was a team effort, Mrs. Santiago," she said, her gaze drifting to Fatima Zara, who stood nearby, a faint, proud smile on her face. "Nurse Zara's assistance was invaluable. And Dr. Chen will be managing his post-op care. He's in excellent hands." Fatima, though touched by the acknowledgement, shook her head slightly. "Anika," she whispered, "you did this. All of it." Dr. Holloway stepped forward, her initial shock giving way to a more pragmatic concern. She looked at the improvised equipment, the meticulous repair visible on the monitor. "Nurse Patel," she began, her voice still a little shaky, what was that?" Anika met her gaze, calm and unwavering. "A minimally invasive repair of a traumatic diaphragmatic hernia, Dr. Holloway. Complex adhesions to the pericardium and spleen were carefully dissected, and the diaphragmatic defect closed using a non-absorbable suture. The modified bronchoscope provided excellent visualization, and the improvised trocars allowed for precise manipulation." She spoke with a detached, clinical precision, as if explaining a routine procedure, not a revolutionary act of defiance. "But, how?" Holloway pressed, her eyes narrowed. "This isn't standard protocol. Your credentials don't indicate." It was Nurse Zara who, unable to contain her pride, interrupted softly. Anika wasn't trained here, Dr. Holloway. Before Aethelred, she spent years with Doctors Without Borders and Global Health Collective. She's worked in field hospitals and war zones, disaster areas. She's performed high-pressure surgeries with whatever was available, carving out shrapnel, repairing organs, often with only a penlight and basic instruments. She's a master of improvised surgery, of making miracles happen with next to nothing. The revelation hung in the air, a profound truth that recontextualized everything. Tanaka flinched as if struck. Volkov's eyes widened further. This wasn't just raw talent, it was deeply honed expertise born from the most brutal proving grounds imaginable. Dr. Holloway's gaze softened with a dawning understanding, and perhaps, a touch of admiration. The rookie nurse wasn't just a nurse, she was a battle-hardened surgeon in humble disguise, her quiet demeanor belying an unparalleled skill set forged in the crucible of absolute necessity. "We had you slated for immediate suspension, Nurse Patel," Dr. Holloway continued, her tone now entirely different, devoid of any threat. "But it's clear now that we fundamentally misunderstood the situation. We underestimated your unique qualifications, your dedication, and your exceptional skill. You saved a child's life where our conventional methods, or rather, our conventional fears, failed." She paused, then added, her voice tinged with genuine regret, "Aethelred Memorial owes you a profound apology, Nurse Patel. And its sincerest gratitude." Anika simply nodded, accepting the shift in tone with the same quiet grace she had faced ridicule. "My priority was always Leo's life," she stated simply, her gaze returning to the boy who now lay peacefully. "And it will continue to be for all our patients." Her humility, unwavering even in the face of such profound validation, was perhaps her most remarkable trait. She hadn't sought glory, only to save a life, and in doing so, she had inadvertently carved a new path not just for herself, but for the very ethos of Aethelred Memorial. The hospital's rigid hierarchy had just been forced to bend to the undeniable force of true, life-saving innovation. The following days at Aethelred Memorial were a maelstrom of activity, the aftershocks of Anika's audacious act rippling through every department. While Leo Santiago remained in pediatric ICU, recovering with an almost miraculous steadiness, the real drama unfolded behind closed doors. The board of directors, usually reserved for quarterly financial reviews, convened in an emergency session, their faces grim, a thick dossier outlining Nurse Patel's unsanctioned intervention at the center of their polished mahogany table. Leo's parents, once frantic with despair, now clung to Anika's every word during their visits, their gratitude a tangible, overwhelming force. They had already issued a public statement, shared widely by sympathetic media, detailing how a compassionate nurse, against all odds and protocol, saved our son's life. This placed Aethelred Memorial in an unenviable position, punished the hero, or embraced the unprecedented. Dr. Kenji Tanaka, the once unassailable chief of surgery, found himself at the epicenter of the storm. His initial bluster had evaporated, replaced by a sullen, defensive posture. The formal inquiry unearthed not just his cancellation of Leo's surgery, but a pattern of risk aversion that prioritized the hospital's pristine reputation and his own flawless success rate over desperate patient needs. The administration, spearheaded by a newly decisive hospital director Hayes, could no longer ignore the glaring disparity between Tanaka's rigid adherence to protocol and Anika's life-saving ingenuity. The board's decision was swift and uncompromising, though carefully worded to mitigate public scandal. Dr. Tanaka was relieved of his duties as chief of surgery, formally placed on an indefinite administrative leave to explore new methodologies in surgical risk assessment. Informally, it was a demotion, a public stripping of his power and prestige. His office was cleared, his nameplate removed. The hospital's carefully curated image of surgical excellence, once tied inextricably to Tanaka's ego, was now irrevocably tarnished. He left Aethelred, not with a bang, but with a whimper, his career fractured, his reputation in tatters, a cautionary tale whispered in the sterile hallways he once commanded. Dr. Sergei Volkov's trajectory was different, though no less humbling. His initial dismissal of Anika, his sneering arrogance, was well documented. During the inquiry, confronted with the undeniable evidence of Leo's recovery and Anika's unparalleled skill, his defensiveness fractured. He still muttered about protocol and safety, but the conviction was gone. Director Hayes, however, saw a flicker of potential beneath the bravado, a mind that, if redirected, could perhaps learn. Volkov was not dismissed, but reassigned. Effective immediately, he was transferred to a newly established Emergency Surgical Innovation Unit, where his primary, and sole, duty was to shadow Anika Patel. He was to observe, assist, and most importantly, learn. The senior resident, accustomed to barking orders, found himself relegated to the role of an apprentice to a rookie nurse, a bitter pill to swallow, but one enforced by a career-threatening ultimatum. For Anika, the outcome was equally profound. Director Hayes, having witnessed Anika's unflappable composure and surgical prowess firsthand, saw an opportunity to redefine Aethelred's future. The initial disciplinary action against Anika was not just reversed, but publicly lauded as a demonstration of selfless dedication and extraordinary skill. Then came the offer, a newly created position, Director of Clinical Surgical Innovation and Field Techniques. This role would task her with developing rapid-response surgical protocols for complex, time-critical cases, training residents and nurses in improvised techniques for resource-scarce situations. A direct nod to her NGO past, and fostering a culture of adaptable problem-solving within the operating theater. Anika, ever modest, initially hesitated. The idea of a formal, administrative title, a stark departure from her quiet nursing duties, felt alien. Yet, the vision Director Hayes presented resonated deeply with her core values. It wasn't about prestige, it was about equipping others, about saving more lives, about bringing the invaluable lessons learned in dusty field hospitals to the polished corridors of elite medicine. It was about creating a system where no child, no patient, would be left to die because of rigid protocol or a lack of imagination. The hospital leadership embarked on a radical reevaluation of its protocols. The Aethelred way, once an unyielding doctrine, began to bend. Debriefings post-Anika's surgery revealed that many nurses and junior doctors had harbored innovative ideas, but fear of retribution or dismissal had silenced them. Anika's promotion was a clear signal. True expertise, adaptability, and a patient-first approach were now to be prioritized over strict adherence to conventional methods alone. The hospital would establish a grant for rapid response innovation, encouraging staff to propose and test unconventional solutions to medical challenges. Leo Santiago made a full recovery. His small, scarred chest was a testament not only to Anika's skill but to the indomitable human spirit. His parents, forever grateful, became quiet advocates for Anika, their story a powerful reminder that heroism could emerge from the most unexpected places. Leo, unaware of the institutional earthquakes he had triggered, returned home to his toys and his parents' embrace, his diaphragmatic hernia a distant, terrifying memory. Anika Patel, the quiet nurse, did not return to her authentic life unchanged, but rather, her authentic purpose had found its rightful platform. She didn't seek power or accolades, but the new role allowed her to channel her unique gifts, her precise hands, her inventive mind, her unwavering compassion, towards a broader impact. She remained humble, her focus always on the patient, but now she had the authority to effect systemic change. Her presence began to subtly reshape Aethelred Memorial, slowly but surely chipping away at its rigid hierarchy, forcing it to value a different kind of brilliance. It was a new paradigm, one where the quiet strength of empathy and the courage of innovation could finally triumph over the cold calculus of status and fear, promising a future where expertise, in all its diverse forms, would truly transcend titles. Fast forward a few months, and the bustling Aethelred Memorial now echoed with a different kind of authority. Anika, no longer just a rookie nurse, stood at the front of a packed lecture hall, demonstrating an ingenious, improvised technique for complex abdominal repairs using readily available equipment. Among the attentive residents was a humble Dr. Volkov, meticulously taking notes, a stark contrast to his earlier dismissive demeanor. Anika concluded with a quiet smile, her actions speaking louder than any title. Her story reminds us that true expertise isn't found in a nameplate or a corner office, but in the hands that heal and the minds that innovate, often from the most unexpected corners. What part of Anika's journey resonated most with you? Share your thoughts below. If you were inspired by her quiet strength and groundbreaking skill, make sure to like this video and subscribe for more stories that redefine heroism. Remember, courage, compassion, and true brilliance will always find a way to shine, no matter the obstacles.